Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Treatments for urological cancers can improve survival, but they can induce significant side effects involving the skin. I'm talking about this with a medical student from Upstate's Norton College of Medicine who was co-author of a paper on that subject in the World Journal of Urology. Michael Sun, welcome to The Informed Patient.
Hi, Amber. It's so nice to meet you and have this opportunity.
What are the cancers that are considered urologic cancers?
So the term urologic just means it pertains to the prostate, the bladder, the kidney, as well as the testicles and the penis, just cancers that have to do with basically the excretionary system of the body, so the part of the body that gets rid of waste.
And then the treatments that might be used for the cancers, surgery is one of them. What are some of the others?
Right. So cancer is very sophisticated because oftentimes different cancers require different treatments. Even for urological cancer, surgery is only just one of the many options we like to use. Another option is radiation therapy, where they would basically use radiation to kind of kill the cancer cells. Chemotherapy is similar to that, where you use chemicals. Immunotherapy is where you target the immune system because in certain cases of cancer, the immune system is dysfunctional. It's not working very well, so it can't really kill the cancer cells. So this could be one way to kind of keep the cancer cells in check. And another one, this one's more fancy, is you're using targeted antibody conjugate therapy. So what that means is you're basically putting in these little particles that bind to cancers or something along the cancer pathway and kind of just stops the cancer in its track. But these are very experimental.
Well, why is there a concern about dermatological side effects?
So the thing with cancer is that oftentimes some kind of cell is going out of control. It's growing very exponentially in an uncontrolled fashion. And the way we target that is we treat these rapidly growing cells. And the problem that comes from this is that other cells are also very rapidly growing and they're normal cells. So this can be skin cells, hair cells, and even nail cells. And what happens is when you target these cancers, you're putting these fast growing cells at risk as well to the treatment.
So that's why oftentimes hair loss might be part of the side effect of a cancer treatment, right?
Yeah, hair loss is often a side effect. In medicine, we call it alopecia. It's basically hair loss induced by cancer treatment or other treatments. And it's just because of the fast growing property of hair.
So does this side effect on the skin, does that affect whether a person goes through with treatment?
So that is definitely a consideration. I can't speak for this matter exclusively, but I did notice that for this treatment, a lot of patients do ask questions about it in the sense of what side effects am I going to get? What can I expect? And while it's very important for physicians to inform these patients that, yes, hair loss as well as other rashes, etc., can be an issue, I think it's very rare for patients to discontinue this treatment just because we're treating something very severe. And usually with treatments, I don't want to say usually, but in most cases, when you use the right treatments for the patient and there's no extenuating circumstances, the skin-induced side effects will go away.
Well, let's start with surgery. Is scarring the biggest dermatological issue with surgery?
I would say scarring is definitely a concern post-surgery. Scarring is very common, but the good thing about scarring is that it will fade, albeit gradually. Some people, it really depends on the disposition, the skin, as well as their genetics. But some people, they might have thicker scars. So they might have something called a keloid scar, where the scar kind of grows outside the boundary of where the surgical site is. And keloid scars, they are something to be concerned about because they can reoccur. But usually scarring will fade on its own.
What are the side effects that are most common with chemotherapy?
I would say for chemotherapy, something to keep in mind is hair loss is relatively common with chemotherapy. There can also be fatigue. You can be more tired. Again, chemotherapy is something, it really depends on which type of chemotherapy is being used, as well as the person. A lot of these cancer treatments are very personalized depending on whether someone is more compatible with it or if it's worked in the past for them. So it really does vary, but hair loss and fatigue are very common.
Does the hair loss improve after the chemo stops?
I would say usually it does because chemotherapy, like I mentioned before, targets these fast growing hair cells. And once you stop targeting them, naturally they will grow back. But the thing to be considerate of is that sometimes the hair may grow back with a different texture or color. So it might not be the exact same hair, but it will tend to grow back.
Now, what about rashes? Do you see that with chemo or is that more with radiation therapy?
I would say that rashes for chemo is pretty common and it can vary. So you can get a mild irritating rash. So something that is like there, but not very noticeable for patients except from time to time. Or you can get something more widespread. So itchy bumps. This really just depends on the individual, but rashes are relatively common in chemotherapy.
And what is photosensitivity?
So photosensitivity is when you have increased sensitivity to sunlight. So this leads to easier sunburning. And this usually occurs when there's something wrong with the DNA repair, because usually what happens is when the sunlight hits your skin, there is something called ultraviolet light, and that could induce damage in your DNA. However, usually your DNA has these repair enzymes, which are proteins that go in and they fix these like I would say damages caused by the UV radiation or ultraviolet radiation. But sometimes in chemotherapy or cancer treatment, these repair mechanisms aren't as good as they usually are, or something else is going on, and that can lead to photosensitivity.
What is hand foot syndrome? I had not heard of that before.
Yeah, so hand-foot syndrome, it's very self-explanatory in a way because it really focuses on the palms and the soles, so your hands and your feet, and it causes basically redness, swelling, and tenderness, sometimes even peeling of the soles and the palms. And that's something that we usually try to keep into consideration for certain cancer treatments.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Michael Sun. He's a medical student in Upstate's Norton College of Medicine, and he was a co author of a paper in the World Journal of Urology. Now, regarding radiation therapy for urologic cancers, can you tell us about recent advances that have reduced the risk of dermatological side effects?
So the thing with radiation therapy is that it's a very rapidly growing science. And modern radiation methods like the IMRT or SBRT. So I know those abbreviations are hard to get a hold of, but they're basically intensity modulated radiation therapy, IMRT, and stereotactic body radiation therapy, SBRT. What these radiation therapies aim to do is they shape the radiation so that's more precise and you reduce the amount of skin that's exposed to it. So this can do a variety of things. Number one is you really reduce the amount of adverse skin effects that you might have from radiation therapy because you're getting a smaller surface area. And the second thing is you can really hone in on these cancers that you're trying to treat by targeting them more specifically. So maybe you can use more advanced treatments now that you know that there's less risk of side effect. But again, these are very novel technology, so there's more to be known about them.
Is there still a concern for dermatitis or eczema for people that undergo radiation therapy?
It is possible where you can develop radiation dermatitis, which is a skin reaction in the area you treat, and it will commonly resemble a sunburn or dryness or peeling. It is kind of known as eczema, but in this aspect, it's specifically caused by radiation. Usually, eczema is not a radiation mechanism, it's usually something to do with the immune system being hyperactive.
What is long term fibrosis?
So fibrosis is something that happens when doesn't just pertain to the skin, but it's when a certain part of your body thickens or becomes more firm. So if we're talking about the skin, it would just be a part of your skin that becomes more thickened or firm. And this is just due to more fibroblast activity. So fibroblasts are basically cells that secrete collagen, which is used in a lot of skincare products to kind of reinforce the skin in a way. So when there's too much reinforcement of the skin through collagen, that's when the skin kind of becomes more thick and firm. And this is something that can happen, I would say, months or sometimes years after radiation as a component of scarring. And it is something that physicians should be aware of when giving cancer treatment.
Interesting. I didn't realize that it would be kind of a long-term side effect potentially.
Yeah, so radiation can sometimes trigger these long-term tissue inflammation side effects. The reason why it's more long-term is a scar formation is something that takes time, and the collagen builds up over time. So it might not be something that you notice after a few days or even a few weeks. It might be months or years down the line just because of how long the mechanism is. If you think about like scarring, if you fall off a bike and you scrape your like knee, sometimes that scar is there for a very long time. I know for me personally, I've I used to bike a lot and I scraped my knee really badly once and I still have the scar and it's been 5 years. So it's just something to keep in mind that long term, there's a lot of things going on in your skin that might not be clear to you, but it is very important for us as physicians to keep account of.
I see. Now, what may happen after immunotherapy?
So immunotherapy, something that's very common, is itching in the form of rashes, or something that might not be as well known is that you can lose the pigment in your skin. And that's something to consider.
If you lose the pigment in your skin, is it uniform or splotchy?
It really depends. Usually, I wouldn't say usually, but something that can happen is in vitiligo. And this is a loss of skin pigment, which appears as lighter patches. So in this case, they would kind of be patchy skin. And this is caused when the immune system becomes hyperactive and they target the cells that make the skin pigment. So by kind of destroying these skin pigment cells, which are called melanocytes, you actually don't have the pigment that you're supposed to have. So the skin pigment starts to fade away, and then you get these lighter patches on either your skin or your scalp.
Does the pigment modulate once the therapy's over with? Or is this a permanent change?
This is unfortunately another one of the things that varies by the patient. Sometimes the pigment will return, albeit like gradually. However, in some cases, the changes can be permanent. I'm not an expert on this specifically, but I can say that I think it would depend on the melanocytes, which are the pigment producing cells, and how they're affected by the cancer treatment.
Now, radiation, chemotherapy, and immunotherapy are used for a variety of non-urologic cancers as well. Would people with those types of cancers be at risk for some of these same dermatologic side effects, do you think?
Absolutely. Because with cancer treatments, regardless of the cancer, we really just want to stop the abnormal, unregulated growth of these cancer cells that are kind of spiraling out of control. And by targeting fast growing cells, which most cancer treatments do, you target the hair cells, the nail cells as well, because they're also very fast growing. So, just by the nature of hair cells and skin cells, sorry, I forgot to mention, it's something we always have to consider just because they share so many things in common with cancer cells that when we treat cancer, naturally the hair, the nails, and the skin are going to be affected.
Do oncologists automatically refer patients in treatment for cancer to a dermatologist? Do you know?
I would say that this is a consideration that some physicians will make. However, it's definitely not uniform because for these treatments, as unfortunate as it is, the dermatologic side effects are not really emphasized as much as other ones that are more severe. So, something that can happen with cancer treatment is sometimes you can have muscle loss or develop some kind of secondary infection because sometimes these cancer treatments they put a tamper on your immune system so that can increase your chance of getting infected with bacteria or viruses. And sometimes that is taken in precedence over the side effects because oftentimes people see it very unfortunately that these are very like transient, they're very small in a way, even though I don't necessarily agree. And that's something that hopefully physicians can pay more attention to.
What do you and your co-authors think healthcare providers or even patients can do to minimize dermatological side effects? Is there anything that can be done?
The first thing is 100% all physicians should inform the patient before they go into any of these treatments that these are the side effects, as well as how long you can expect them to last. And make the patient really know what can happen before they make the choice of going through with chemotherapy or immunotherapy. And after that, you can do a preventative treatment to kind of prevent these things from happening. So, photosensitivity, something you can do to treat that is use sun protection on all parts of your body. Something that I've noticed when I was helping out at a dermatology clinic is a lot of patients, they don't put sunscreen on their hands. And that's something that is really important, especially if you drive often, is that your hands are exposed to basically the sunlight as it goes on the steering wheel. And over time, that can really build up. You'll get a lot of wrinkles and it can even lead to cancer. And something else that's really important is moisturizing. So, by keeping the skin healthy and moist with these moisturizers, you can basically keep the layer very intact. And this can prevent certain stuff such as rashes or irritation for certain patients. And lastly, we just want to make sure that the patients, whenever they have these symptoms, that we follow up with them, especially after treatment, because oftentimes it might take more than just a week for these symptoms to show up. So it's important for physicians to keep in contact with patients even well after the treatment is over.
Wow. Well, Mr. Sun, thank you so much for making time for this interview. I appreciate it.
Yeah, of course. Thank you so much for having me.
My guest has been Michael Sun, a student at the Norton College of Medicine at Upstate Medical University. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.